ASTIC has always been known for excellence in plastic surgery outcomes and compassionate care. Our goal is to bring state-of-the-art services and procedures to fulfill the aesthetic needs of our patients. This is why we are proud to offer hair transplantation to our clients. My name is Julio Clavijo Alvarez. I'm a plastic and reconstructive surgeon. I recently joined ASTIC as a staff physician. I did my training in plastic surgery at the University of Pittsburgh Medical Center, also known as UPMC. After I finished my training, I had the opportunity to visit Dr. Alfonso Barrera. He is a well-known hair transplant surgeon. He has published a book and numerous papers on the topic. During my time with him, I was able to learn the most novel advances in hair transplantation. I have fashioned my technique protocols after his to assure the highest standards of outcomes and care. This video presentation is intended for patients interested in hair transplantation. I hope that this information will allow you to understand the problems of hair loss as well as the surgical alternatives for its treatment. Healthy hair has been acknowledged as a symbol of attractiveness and youth. Despite the fact that hair loss remains to be a socially accepted condition among the male population, it is still a source of anxiety and loss of self-esteem of individual men. This graph demonstrates the prevalence of hair loss in males throughout life. Notice that by age 40, marked by the blue line, almost 20 to 40% of males suffer from baldness, as shown in these two studies. The myth is that baldness has been associated only to males. However, it has been revealed by multiple studies that females also suffer from this condition. This graph shows that women are affected with androgenic hair loss in 8 to 30% of the cases. Let's discuss some of the causes of hair loss. The first and most frequent one is androgenic alopecia. This type of hair loss is related to hormonal sensitivity of the hair, which favors its loss. Other causes of hair loss are listed here. The indications for hair transplant surgery are body image, recreate the hairline, rejuvenation, and reconstruction. When is the best timing for treatment? Do not wait until it's too late. Prevention is the key. Once you notice some deepening of the temporal hairline, it's adequate to consider the transplant. Now let's talk about the different types of hair loss patterns. These are the patterns of male hair loss as described by Dr. Norwood. Patients with Norwood classification 2 through 6 are good candidates for hair transplant. Females have a different pattern of hair loss. As you can appreciate here, the hairline is preserved generally. However, there is progressive hair loss of the superior aspect of the head. Hair transplantation is a great solution for these women. As part of your surgical consultation, we will discuss the medical preparation prior to surgery. Now we will talk about the surgery itself. I will show some diagrams and photos of the procedure. Be aware that it's going to be graphic. Let's start with my preferred method of donor site harvest. In the preparative area, the donor site will be prepared by taping a bob and clipping the hair of the donor site. Then the patient will go to the operating room to be sedated. In addition to the sedation, I will inject the donor site with numbing medication, lidocaine and epinephrine. With the patient sedated and anesthetized, we will harvest the donor site, as shown here. Let's talk about the donor site process. When using the traditional method, we slice the hair strap into rows as shown in the left. The right is the actual sample. The next step is to divide each row into follicular units of 1 or 2 follicles, also called as micrografts. We also use 3 to 4 follicular units, called minigrafts. The most important part of the procedure is to preserve the bulb of the hair, in addition to its additional components. Failure to do so will result in less graft take and a less optimal outcome. Once the mini and micrografts are ready, we patiently insert them one by one. By now you will be fully awake but completely numbed. At the end of the procedure, you will look something like this. Let's discuss now what to expect after surgery. Immediately after surgery, you will have minimal pain. If anything, you will be still numbed. You will have a bulky dressing for 3 days, and this dressing needs to stay dry. However, you will be allowed to shower below the neck. The overall time down is 3 to 4 days. Once we remove the dressing on day 3, you can go back to work on non-physical activities. Some patients may develop mild upper face swelling that resolves by 1 week. During your consultation, we will discuss our simplified protocol for your new hair care. Activity-wise, you should be away from heavy lifting or from activities that increase your heart rate. This is how your hair will grow. The first month, your transplanted hair will grow. Then it will shed for the next 2 to 4 months. By the 4th month, it will restart to grow. If you are planning on improving the thickness of your transplanted area, you will need to wait for 1 year before you do the next session. The good news is that the success rate of graft take is 95%. Most patients may need 2 or 3 sessions to improve their hair density or to cover all areas. Let's talk about some complications that we might encounter. General complications. Almost all of them occur in less than 1% of the patients. Your risk of bleeding and infections are extremely rare. Numbness is transient and improves within months. You may experience some ingrowth hair. Scarring is a must. Usually it is invisible because it's hidden by the surrounding hair. For better outcomes, better healing, and less scarring, I recommend to not smoke around the time of surgery. Other remarks. There is another method that is being heavily marketed. It is called neograft. In summary, this is a microdrill with a suction device attached to the back. First of all, you will have to be fully shaved. Rather than having a strip of hair removed, it drills the hair follicles from everywhere in your scalp, risking future graft donor areas. These are some other reasons not to use this novel method. We have already talked about the importance of preserving the integrity of the grafts, which optimizes your final outcome. The biggest disadvantage of the drill machine is the damage of the hair follicles, up to 50% of the cases. Some considerations for choosing the site of your transplant are: make sure that your surgeon is a plastic surgeon. Also confirm who is doing the insertion of your grafts. In many places, the surgeons only harvest the sample, slices the scalp area, and then disappear. Then technicians with various levels of training will place your grafts. In my opinion, the graft insertion by a trained surgeon defines the difference between a mediocre result and an amazing one. Besides, your investment is worth the time of your provider. Thank you for your attention. I hope that this video presentation was useful educating you in hair transplantation. If you have any further inquiries, please be welcome to contact us. Thanks again and have a great day.